I'm going to be talking or focusing on two issues here. One is the European and developing countries clinical trials partnerships, and also uptake of innovations for healthcare. I know you all know a lot about innovations for healthcare, and Pascal has just outlined some, but I'll be interested to know how many people really have heard before of EDCTP. So if you don't mind, by show of hands, we'll just get some people to put your hands up if you've heard about EDCTP before. Now, this is actually important for us. Now, this is actually important for us because EDCTP is doing a lot in supporting innovative ideas, clinical trials, research in Africa, but very few people, investigators, really know about EDCTP. So I'm glad I've got this opportunity, but I don't want to start talking about EDCTP now. I just want to outline some of the things that I will be addressing as far as what role EDCTP has played in some of these innovative aspects around partnership models based on inclusiveness and equity. I'll try to explain, you'll know a little bit later, why partnership, having innovative models in partnership is quite critical. But also innovative approaches for capacity strengthening in Africa. There have been a lot of efforts here to try and strengthen capacity. So many capacity development models have come, but they've disappeared. Why is this happening? And why do we think we now have a model that we can be talking about? Again, so this is about networking of local innovators and research leaders. This is all the strategy around innovation in that aspect. And then the obvious things that most of us know about and that Pascal outlined, which are digital and mobile health solutions. So as I said before, it was really important for me to know what EDCTP is all about. And then I'll just briefly introduce some aspects of why we think we need a special model for partnership, innovative model for partnership in Africa. Recently, there was an editorial in the Lancet Global Health closing the door on parachutes and parasites. And so I've highlighted it. I know some of you have problems reading the screen, but from that editorial, what this was said, no one likes a parachute researcher. The one who drops into a country, makes use of the local infrastructure, personnel and patients, and then goes home and writes an academic paper for a prestigious journal. Now, we all know this kind of experience. So what innovative ideas do we have to make this difference so that this does not involve? So I'll be addressing that as far as EDCTP is concerned. So we did, myself and some of my colleagues did write to the correspondence in response to that editorial to demonstrate that EDCTP really has a model to show that. But just writing in a scientific journal is not enough. So I wrote a paper for a wider audience in the conversation, and in the conversation, which has over 30 million subscribers, and that was the article was also picked up by Flipboard, which over 100 million people access. So it really, the way conversation presented is how a partnership is closing the door to parachutes in Africa, and in the panel discussion, I'll try and address that. But just to show how is EDCTP important, why are we doing this? I mean, those of you who know EDCTP, it's a partnership between European and African countries, 14 European countries and 16 African countries, and then 2 aspiring members. We'll get into that later. So, and then I'll talk about how EDCTP addresses the different innovative ideas that were put down. But most importantly, again, why is EDCTP important? Because in addressing all these innovative ideas and what our role has been in ensuring that we have uptake in innovation for healthcare is the amount of money that we have been using to support all these innovative ideas. In the last 4 years, EDCTP have been making calls across the board for about 100 million euros each year. So it's been a lot. So, but I'll stop here, and then during the panel discussion, I'll discuss the different aspects and the role that EDCTP is playing to address them. Thank you.